Hi, everyone. Welcome to our presentation today on addressing inclusivity in critical community, brought to you by WebMD Health Services and our client, Health New England. I think it's safe to say that the well-being landscape has changed in the last year, especially for health insurance providers who are really attempting to engage with members, their employer groups, as well as their communities, and really around the topics of inclusivity, social determinants of health, and mental health. That's why we're really excited to be able to partner with our client, Health New England, and on today's presentation. You'll be able to learn how they were able to partner with their local communities to address diversity, the pandemic, and create access to emotional health programs. My name's Alex Nguyen. I'm the Vice President of Product and Solutions for WebMD Health Services. And today I'm joined by Katie Bruno, the Public Health and Wellness Manager, and Julia Wilkins, the Health Management Program Specialist for Health New England. Before we get started, just a reminder, there is a chat box below, and we're going to be really, Julia, Katie, and I are going to be here to answer any questions you have. So throughout the presentation, feel free to pose some questions. So first, I wanted to talk a little bit how we partner with Health New England and really how we're uniquely positioned to meet your needs. WebMD is a trusted brand. We are a part of the WebMD brand of companies, and we really see that having a trusted brand really encourages trust in a program as well as program participation. We're leaders in the space. We've been working with clients on wellbeing programs for over 2 decades now, and have helped over 60 million individuals improve their lives. And we're trying to increase that every day. We also have a real comprehensive suite of programs that really touch on all aspects of wellbeing. When we work with our clients, we really have some best practices and fundamentals that we work with them. And our data shows that those that follow those fundamentals see a higher risk reduction in their programs versus those that don't. And lastly, when it comes to quality and security, we really have the highest standards. Our programs are NCQA accredited, and we've helped our clients win awards such as the CIA Recoup Awards and the MBGH Best Employers for Healthy Lifestyle Award. So how do we do that? And really, it's about taking a holistic approach to well-being. So when we look at the dimensions of well-being that WebMD really follows, it's around physical fitness, being emotionally balanced, clinically managed, socially connected, and financially secure. And it's really important because well-being is personal. We have to be able to meet people where they're at, and being able to cover all these areas is really core to our approach. Another thing that we do that's really unique is around targeting our programs. So when we talk about programs not being one size fits all, it really is about segmentation and personalization. How do you get the right information and programs to individuals at the right time? And when I say personalized, it's not just slapping a client logo on a site. Although we support that, it's really about digging in deeper. So when we look at our segmentation and our architecture, that's really core of how we segment our populations. We work with our clients, and we can segment by lines of business. So we think commercial, individual markets. Within commercial, we can maybe segment and actually have a higher levels of configuration or customization for larger employers, but smaller groups, maybe more of an overall program offering for them. And then when we get into an employer group, when we talk about very specific, such as business unit, physical location, job status, it's those levers that we can really target information that makes our program so valuable. And lastly, it's great to be able to hit all those populations, but part of our real advantage is being able to support that at scale. So we've built our system, if you can make one change, and it'll update all the employer groups. Or maybe you have one very specific employer, and we're going to go all the way in and configure something in a program that's very specific to them in a location, such as an on-site fitness facility. This flexibility and scale is really where our clients see value in our ability to target programs. So we talked about, how well-being isn't one size fits all. We talked about how you need to be able to reach your population in different ways, really depending on their well-being goals. But what about the actual health of your population? How can we help build that well-being immunity? I'm going to share some interesting information with you regarding the pandemic's impact on overall health and well-being. We partnered with Blue Research, and we did a survey of employees who are working for large employers. So this is defined as, over 1,000 employees. And the goal of the survey was really to look at employer wellbeing programs and benefits and what employees were actually looking for expectations from an employee or member perspective. So one of the first areas we saw was not surprising. With the pandemic in the last year, over 1 in 4 employees had indicated that they had considered quitting their job as a result of the pandemic. I'm really curious of what this group, those that are attending, think of this number. Are you seeing similar impacts with your employer groups, maybe with your own employees? Please feel free to use that chat box below to kind of make your comments or ask any questions there. Another item that we saw, it's not a surprise, and we don't need to do a survey to figure this one out, but a high percentage, over 77% of people, it reported that the pandemic had a negative impact to their overall well-being. So although the number wasn't a surprise, what we really wanted to do with the survey was understand exactly what about COVID-19 had impacted the well-being of these employees. So we looked in the data a little bit further. We talked about the 5 dimensions of well-being that WebMD looks at: physical, mental, social, clinical, and financial. And the data was really showing us that COVID-19 was impacting all 5 of these dimensions of well-being. So when we looked at, if you look at all these areas of focus, you can see that, it really is around those 5 dimensions. And so, one thing is that came out of this, we know everyone had their own situation that's really unique, but one thing was clear: you and WebMD, we have an opportunity to offer more support to the members and their workforces. And Health New England today is going to share some great ideas about how they're building up their well-being immunity. But it's really not just well-being that was impacted. So again, if we look at some of the data around social determinants of health, over almost half the respondents reported that the pandemic had a negative impact to their health or that of their families. And really in these categories that we see around really social determinants of health. So, access to food, feeling safe in a neighborhood, not having access to medical care. And one of the real outcomes of this is, we see in this data, and we're seeing trends with our clients as well, that really this interplay between the environment that somebody kind of lives and works in is having a greater impact on their well-being. So when we break it down, something as simple as your workspace, do you feel comfortable, included in your workspace, as it extends into the team that you work on, the leadership within your organization, and then outside of that, in your neighborhood, into your community, your broader community. It's really interesting of how we'll look and see how programs can start to bridge that environment outside of the workplace. Another area that really was highlighted in the survey was the desire for a true comprehensive well-being program. So beyond just digital tools, but really extending out into other programs. So, really across the board, we saw around 40% of employees really wanted services around fertility and family planning, social connectedness programs, at-home fitness. And when we talk about the concept of inclusion, 4 in 10 also reported that they would like to have LGBTQ resources. So as we see this shift, we have been seeing it for the last couple of years of more comprehensive programs. One of the things we're also seeing in this data was that it's getting in stronger desire in younger generations. So in this next chart, you'll see we looked at millennials and Gen Z. So as a reminder, millennials are 26 to 39, Gen Z is 18 to 25, and they really had similar answers of their desires for these areas of support. One thing I wanted to highlight was, if you look at mental health in Gen Z, 80% wanted resources around mental health. And so when we start to dig into those numbers, it's not necessarily a surprise. Gen Z, they grew up their whole lives with the concept of the internet, social media. The types and variety of stressors they have is really different from a lot of other generations. I think in addition to that, the overall awareness of mental health issues, mental health literacy overall is a lot more heightened. And also we've seen a shift in the stigma, away from the stigma of access or using mental health resources. I think a great example is you've seen, even just more recently, athletes being more open about their struggles with mental health, and really bringing it to the surface, kind of a concern overall. Again, the data here that we're seeing is in these younger generations. I'm really curious if in the chat box below, if you're seeing the same trends in your populations as well. So you've heard enough from me. So we're gonna hear from our client, Health New England. During today's presentation, we'll focus on 4 objectives: how to deliver a proactive well-being strategy versus a reactive strategy, understanding social determinants of health, especially relating to the pandemic and health equity in underserved communities, how to use a data-driven approach to tailor programs that resonate with large member populations, and really learning how 5 specific organizational pillars can help improve the health of your members. So let's meet today's speakers. First, we have Katie Bruno. Katie is the Public Health and Wellness Program Manager at Health New England. She has over 10 years of experience in the development and implementation and evaluation of population health programs. In addition to managing the health management department, Katie oversees the Community Benefits Program and co-chairs the Diversity, Equity, Inclusion, and Belonging Committee at Health New England. We'll also hear from Julia Wilkins. Julia is the Health Management Program Specialist, and she's been developing programs and initiatives for municipalities, community centers, corporate fitness, health plans, and hospital environments for over 15 years. Her passion is helping to foster one's overall well-being, and she's trained to teach in the areas of exercise, chronic disease self-management, and resilience. So Katie and Julia, thanks for being here with us today and for being great partners. I'll hand it over to you.
Great, thank you, Alex. We are really excited to be here with everyone and to talk to you all today. So just to give a little bit about Health New England, we are a regional non-for-profit health plan located in Springfield, Massachusetts. For those that are not familiar with Massachusetts, if we have any sports fans in the audience, it is where the Basketball Hall of Fame is. So that's where Springfield, Massachusetts is, not Boston. We are a mission-driven company. Our mission is to improve the health and lives of people in our communities. This applies to our members and to associates in our workplace as well. It applies to individuals of all races, genders, sexual orientations, religions, and all levels of ability. So that people really feel that they matter. It's where your health matters, and all by all for all. We serve all lines of business, so commercial, Medicare, Medicaid, and the marketplace. And lastly, we are really unique in the fact that our parent company is Bay State Health, which is a healthcare system, and we're really able to integrate and align in a lot of our efforts, which I'll be highlighting later today. So for today's presentation, I'm going to talk about Health New England's deepened commitment to diversity, equity, inclusion, and belonging. So I will probably refer to that as DEIB because it's a mouthful. In the formation of a company-wide platform and a call to action. So our work really started over a year ago in the wake of George Floyd's murder. A group of associates, we began brainstorming on how Health New England should respond to the public health crisis of structural racism and inequalities. Unbeknownst to us, our president and CEO at the time, who now is executive vice president and chief operating officer at Bay State, Marion McGowan, had already been working on a public-facing statement, which really resulted in not just a public statement, but a 5-pillar call to action that's really created the foundation of our DEIB committee and a multi-prong approach to embedding DEIB into our mission, operations, and values. So as I will discuss Health New England's diversity and inclusion strategy, and to touch base on our work really we've gained the last year. So I would love to hear and read what your organizations are doing in the DEIB space. There's a lot of great work going on. I know just from the organizations that we work with. So please, I would love to read what your organizations are doing in the chat. So we really have hit the ground running, developing strategies and action items for each of the 5 pillars that make up our strategy. And the 5 pillars are associate engagement and education, corporate platform, recruitment and retention, advancing health outcomes, and community engagement. So our first pillar focuses on associate engagement. And my coworker, Ashley Bogle, Assistant General Counsel and Director of Legal Services, and I both co-chair our DEIB committee. So this includes a diverse representation of our associates from different levels and different variety of departments of the company. We typically meet 1 or 2 times a month. And we always start our meeting with a reflection, which is so important, and it's really become the favorite part of our meetings. And this really allows our associates to be vulnerable, to practice listening and learning, and really to exercise our DEIB muscles, which by operating both our hearts and our minds. So by exercising, right, and strengthening our muscles, we're able to practice and bring those values and philosophies into our professional work as well as our personal work. We have an education subcommittee that has just launched the rollout of the dignity model. This is a concept developed by Dr. Donna Hicks, and it was introduced to us through Bay State, who have already successfully integrated it into their systems. In addition, the Education Committee has also released a survey. So we surveyed our associates in the beginning of the year to really get an understanding of what their sense of DEIB was and get ideas on what people wanted to learn and what their current baseline understanding was and how as a company, we can improve DEIB as a whole. So we're currently providing leadership and training for all associates around the dignity model, as well as analyzing the survey results, which will help us determine appropriate programming and education going forward, because the associate engagement is so key, into the strategy of what we're doing at Health New England. And lastly, is through our participating in Bay State's business resource groups known as BRGs. We really believe that it will help advance our integration with Bay State in the areas of diversity, equity, inclusion, and belonging. And this is a really important step in contributing to our system-wide projects and innovation strategies that can really be implemented at H&E and advance our DEIB strategies, as well as professional development and networking opportunities for associates, not only for their social, culture, but professional gains. And then just a few examples of the BRGs groups are LGBTQ+, Pride and Allies, Military, Veterans, and Honor Guard, Black Employees Connect, Women Empowerment, and Young Professionals. So we're really excited to be able to participating and help our employees in various ways to engage within the work that we're doing. So next, for pillar 2, this really looks at using our corporate platform to work ethically every day and to raise awareness and response around health disparities and community and with our community leaders. We have created a 5-year strategic plan based on the 5 pillars I mentioned earlier. What I'm really proud of is that our executive leadership team has actually demonstrated this commitment to DEIB by adding this to our company's goals for 2021. This allows our associates, both individually but collectively, committed and responsible for our company's success in meeting our goals for this year. These are time-bound and measurable goals. If anyone has heard of SMARTY goals, so smart, measurable, achievable, relevant, time-bound, and that IE is inclusive and equity. So when we look at coming up with goals, we have developed the SMARTY goals to really implement within our system. And those goals are in line with our pillars, specifically focused on our recruitment and retention efforts, recruiting diverse talent at every level of the organization, including our board, and committing us to making sure we are educating the organization through trainings and other educational programs and resources to our associates. And lastly, calling out the equity picture on your screen. I'm a visual person, so you're getting a lot of pictures from me while I speak. We have begun developing an equity framework, which is really build off the idea of equity lens to use across the organization to ensure that we keep structural inequities and health disparities front of our mind when we develop our corporate initiatives. So again, we are a mission-driven company. So we really want, our company serves the community members, and we want to ensure that our products and our programs that affect directly our members are achieving their full potential. So if you look at the bottom of your screen, we want to make sure that our programs in Health New England is delivering in the promise of improving the health and lives of our community. So making sure that regardless of who you are, your zip code, your age, gender, et cetera, that you have the opportunity to achieve your full potential, and Health New England is helping you with that. And then we're currently running a pilot program for our health equity, our equity framework with one department to really fine tune, the framework prior to a full out enrollment. Everything I've mentioned is just scratching the surface of what we've been able to do the last year, but we're really excited about the direction that we're going in. And if you have any questions about specifically this work, or if your team is using a health equity framework, I would love to read in the chat what you guys are doing. Any tidbits that I can bring back to Health New England is great. So thank you in advance. So pillar 3 focuses on recruitment and retention. We have separate subcommittees for each of the specific goals that we have at Health New England. So we're able to cover a lot of ground in a little short period of time. But our recruitment and retention subcommittee currently is reviewing our metrics to really understand the demographic and establish a baseline to where we need to go. So a lot, our whole strategic plan is very metrics based and data driven. There's a lot of thought that goes into it, but to make sure that we can measure our progress is really important, especially as we report to our executive leadership team and our board. To hold us accountable for our goals and what we're doing. So our team currently is reviewing our role descriptions for the entire organization, for gender biases, reviewing ways that we can improve DEIB messages on our website. Also identified new and innovative recruiting opportunities that would allow us to engage with more diverse candidates and for candidates, but also positions for the entire organization, including opportunities also to work with local schools to help create pipelines for employment. And then creating and increase access to internal and external professional development opportunities. So, retention is very critical. So it's really important that we are providing access to our associates to help with their professional development so they can either grow within the organization. And I think really that's where the importance of the belonging really shows up is that retention piece, and making sure that our employees, but also our members, feel that they belong within the organization. So the fourth pillar, so there's 5. So we're on number 4, is really both provider and member facing, with the goal for advancing health outcomes. And we know that is so intertwined with social determinants of health. From the provider side, we're really looking at our value-based contracts, expanding our provider networks. So not only from an access base to make sure that, our members have providers that look like them, that can understand them from a race, ethnic background, but also religion. I think that's really important when you talk about care. It's not just access, but having a provider that understands your needs. Making sure that our providers are meeting the requirements for our members and the community, and then giving them access to the training and resources and educational tools that we have available. Providers can be so busy, so it's really important that we take the time to educate our providers as well, because they are member facing, and to really get them on board with really what we're doing at Health New England in regards to DEIB. And then, not lastly, but utilizing and analyzing the social determinants of health to really better understand how Health New England can support our members, particularly those that are part of underserved populations. Health New England is participating in a study geared to reducing the digital divide, especially that was really caused, or I say brought up by COVID, and increasing access to care through methods such as telehealth. So not only providing access within the providers for telehealth, but making sure that our members have access to Wi-Fi, to the proper technology, but also educating them on how to use the technology. So that's really important. And making sure that the quality of care that they're getting is the same as if they're in the office, seeing the provider face to face. So that's really important, that when the member is completed with the telehealth call, that they feel that their needs were met and that the quality of care is still the same. So again, I'm a visual person. So on the left of your image, you'll see the social determinants of health framework. This just gives a good little visual of what that entails and all the different levels and layers of what goes into health. And then I know Julia is going to talk a little bit more about what health management, what our team is doing in the DEIB space. But the image to your right is all the different various health factors that have a direct impact on our health outcomes. And you can see access and quality of care accounts for roughly about 20%. So this is really, this image is really saying, we really need to focus on health behaviors and social and economic factors if we're really truly trying to move the needle and improve quality of life. And, the definition of health is not an absence of illness, but really using this equity framework and addressing social determinants of health programs will only help us move that needle and get closer to advancing our health outcomes. So really this pillar is really near and dear to my heart and the work that Julie and I are doing at Health New England to really improve the health of our members. And lastly, our final pillar focuses on community engagement. So strengthening our policies and practices of community giving and working with our community partners to advance systematic and meaningful solutions of health that are impacted by social influences, including racism in our community. So our community benefits program looks at investing our dollars within local community organizations. And we want to make sure that the community has a seat at the table, and we're not just informing the community on what we think they need, but actually collaborating and inviting them into the decision-making process, right? So what are the pressing, social determinants of health factors that face you on a daily basis, and how can Health New England use our platform and dollars and invest in the community to help reduce those barriers that are caused everyday life. So one of the ways we do this is through our community health needs assessment, known as the CHNA. This takes place about every 3 years. So Health New England collaborates with the Coalition of Western Massachusetts Hospital and Health Plan and a regional advisory council. The regional advisory council is made up with 50 community members, and collaboratively with a consultant, we help conduct a community health needs assessment. So again, this is giving, shifting the power and the dynamic to the community and helping engage them in identifying, health priority areas that then the hospitals and Health New England takes back, which help direct our community benefits strategy for the next 3 years. We have established a Where Health Matters grant program that provides around $50,000 to $150,000 over multiple years to help organizations on addressing specific social determinants of health, so food insecurity, housing, transportation, mental health, social environment, and advancing health equity. Also, this helps increase the organization's capacity as well as lets them plan for sustainability, because that is really key when, again, we are really trying to make a difference. And then lastly, this past fall, we established a DEIB mini grants that awarded organizations on racial inequities and health disparities that also focused on at least one social determinants of health. So again, this is just a little highlight of what we've been doing the last year, specifically in this space. And then really to tie in our efforts for COVID-19 specific, Health New England has participated and currently participating in the Springfield Vax Force. So we've been going out to the community and hosting town halls virtually and really helping educate the community on vaccine outreach and education. Having them being able to answer questions and meeting people where they are is really important, and educating them on COVID vaccine preventative as well as the vaccine. I had touched base on the DEIB mini grants. We also founded COVID-19 mini grants. So last year, Health of England awarded $250,000 specifically to COVID-19 mini grants. We awarded 74 organizations that addressed food insecurity, housing, childcare, education, preventative PPE, so mental health. So really, the COVID-19 mini grants really helped, smaller organizations with their day-to-day functions to help the community in the last year. And then for the DEIB grants, we awarded over $70,000 specific to the DEIB grants. In addition to some of the grants, our Medicaid team also provided outreach and education to our members, as well as our providers, to make sure that our members are getting it from a multi-pronged communications approach. And then lastly, the picture on your screen, you can see our H&E associate, Monique. Being Baystate is our parent company. They are one of the bigger vaccine distributors in our region. So Health New England associates were able to volunteer at the vaccine clinics and help the communities get vaccinated. So just a lot of great work going on at Health New England. I would love to hear, what you are all doing, regarding, COVID-19 specific activities. But now I will turn it over to Julia Wilkins, and she is going to talk about health management. Thanks.
So the Health New England Health Management Team, we've really been focusing on how to be proactive. So we have always been all about prevention, but COVID really taught us that we need to find those who can benefit from assistance, advice for planning around wellness, and tools to improve their health that can be utilized when the unknown happens, not trying to figure it out during. So we've also been working more intentionally with our audience, how to message to them, to our population and their needs. And this includes how we target and message employer groups, as well as working more closely with our case management team to make that greater impact that Katie had mentioned, that 50% impact, on how to develop strategies for groups that we may not have ever worked with previously due to maybe group size, their lack of manpower, or just the dynamics of the group. So on the next slide, we'll see that we've always known that one size does not fit all. That's pretty obvious, but it's really hard to hone in and focus on that when we're working with employer groups and not necessarily an individual. So with COVID, many employees, and I'm sure all of you listening felt the same way, we just felt kind of removed and alone in our wellness journey because we weren't with a group. I know internally at Health New England, we weren't having those nutrition presentations, being able to walk with coworkers during lunch, having on-site biometric screenings. So we really started to look at how we can help the person within that employer group. So we expanded some of our health coaching offerings, and we also explored how we could offer health coaching to additional groups. We began to look at employer groups through that chronic disease lens. So again, working with case management on how we can help in focusing on those areas. And then thirdly, to create packages for special groups. So for example, the aging population. So what do we have on hand that we could really package up and target that group and be impactful? So with those three things, we could really in return use them for retention purposes, but also to be attractive to new groups. So Katie mentioned what Health New England is doing for the community and associates in the way of inclusion, and we wanted that for all members as well. So as I share some of the things that Health New England and our health management team has done, I would love to see in the comments some of the things that you might be doing for your organization to be a little bit more inclusive, or for your members to be a little bit more inclusive. So working with WebMD has been an amazing experience, since they are already ahead of the game and they're always looking to see how things can be better. And they saw how we could change language in the portal and also in the health assessment to be more inclusive. So it's been really great to work with them. They're on top of it, and therefore we can offer that to our members as well. We've also updated our biometric screening process. So traditionally, we ask participants to fill out a form that includes some personal information. We have them take part in a screening, which is blood pressure, BMI, and then they get blood drawn for a lipid panel. And then we review the results with them. So our partner company, Bay State Health, has a gender transition policies that we don't discriminate on identity or expression. And we aim to be inclusive or have transparent communication that align with that organization regarding gender identity and transgender. So our team really wanted that biometric screening experience to be very comfortable for the members. So we have and continue to be trained in the LGBTQ plus and DEIB processes, along with updating our biometric form, and have written policy to ensure that our members, again, feel comfortable and know that they will feel comfortable and come back to their biometric screening year after year, so that we can really then be more effective in evaluating health outcomes. As in most years, we do this, but this year really especially, we wanted to have one of our big goals be to increase WebMD engagement overall. And we're really working hard on measuring and marketing registrations, activity in the portal, and health assessment completion. So we have been running health assessment campaigns a lot this year and really explored all the ways with the different generations and different access that people and our members have. How does that influence our communications? So for our health assessment campaigns, we partnered with marketing and we looked at it a lot of different ways. So one of the things that we did is we had WebMD registration and information pop up for members when they sign on to our member portal, so that we could capture those who haven't even been registered for the WebMD portal, which was one of our challenges. And then also we did some snail mail, some traditional snail mail. And then we also continued our emails, whether it's a employee or member newsletter, as well as our WebMD messaging. So really looking at it from all angles on what people prefer and how they like their communication. And as a result, one of the campaigns that we had in March, we had over 300% increase in health assessment completions. So that was a really great result to see. Also, if we go back to that last slide, we had touch a little bit about this at the beginning, but we were taking programs and resources that we already had and creating those packages to target populations. So while again, working with case management and looking at some of our homegrown programs, we were able to put together one for our aging population, and we're working towards doing that for other groups as well. And our WebMD Pulse surveys were a great tool in letting us see what's really important to our members. You survey members to kind of see what they want and what they need. So 3 of the things that our members said was that they wanted more videos, emotional health resources, and financial resources. And it came at a perfect time with COVID, where that is such a hot topic and such a great need. And so we were able to highlight these offerings in our messaging strategy and offer to groups when they asked for these resources. And we are also able to build a program around some of those things too, which I'll get to later. We currently offer Spanish to certain nodes, and we are opening that up to all of our nodes, or all of our population, all of our members that access WebMD. So that's really exciting to be on the journey to do that. And then, as I mentioned, we were able to update our coaching to not only our moderate and high risk employees have health coaching, but all of our employees have health coaching. So countrywide, we all know that a challenge during COVID was how to reach employees as they're getting inundated with emails, how to really reach them with wellness information that's important for their mental health or overall health, especially during that time. So back in March of last year, when COVID first started, I guess you could say, right away, our WebMD program manager told us about this COVID card that we could have up and ready for members, and it updates them on all COVID information, and we don't even have to do anything. WebMD did it all for us. So that is something that we put up right away, and that we've kept up ever since. Also internally, we created what's called a return to work toolkit for employer groups. So that means everything that the state of Massachusetts is putting out for information for small businesses or any business. We created, you can see on the right hand of the slide, a little toolkit where people can go in and they can search, not necessarily search, but see what topics they might be interested in or have questions about. And we have all the links to all the information that a business might need to go back to work or continue to be at work safely, for things like, what does the CDC say? What is the Massachusetts.gov saying? Where can I find posters that I need to have up in my work site? All those things are right in one place that our employers can see. Thirdly, we also offer to the community, members, anyone who wanted to listen, we had a Where Your Health Matters webinar series. So this was a 6-part series over a span of 3 months where we highlighted different areas of how people could take charge of their health at a time when it kind of fell out of their hands. And so we talked about things like setting goals, how to strengthen your immune system, and various topics that allow people to feel healthy and make a change during a time where they might have felt stagnant. Internally, we had some initiatives at Health New England for Health New England Associates. We partnered with a company for our mindfulness practices. So we really pushed that and had meetings on the calendar where people could call in and do a mindfulness practice. We also offered a resilience and thriving workshop. We did that internally and for some employer groups. That was a great resource on how to go from coping to resilient to then thriving and the tools on how to do that. And then we also really encouraged social connection, which was really hard to do. We tried to do a lot of fun Zoom meetings. So whether that was like a cooking demo or how to organize your closet or something like that, where you had that social connection, as well as an Instagram page with helpful information that allowed the associates to feel connected as well. And then lastly, all of our employer groups, we didn't skip a beat. We were allowed and able to really offer them all the things we had in the past, most of the things virtually. So we were set up already to offer them virtually. All of our programs are webinar based, or we would do them live. So we were able to offer that as well. So a big need in the health world and the wellness world was mental health programs. And so with WebMD 1, we were really able to develop some things per request, and then also just available resources for members. So one of the things that we were able to do, I had mentioned we built a reward program. So for one of our groups, we built a reward program called Mental Health is Overall Health. And what they had to do was go and listen to some podcasts about mental health, answer some questions about it, and they were able to have an incentive at the end. So they loved that program. It's great to have that set up and offered to them as well. We also pushed some of the daily habits on WebMD, especially around staying connected, keep stress in check, and cope with the blues. So this was part of our communication strategy, as well as really highlighting these things as tools that people could use. And daily habits go anywhere from 4 to 8 weeks. So something that someone could really plug away at and use day after day. All right, and then on the next slide, we will talk about some of our outcomes. So that's what we always like to see is how are we doing? How did we do? And so looking at our outcomes, Healthy Directions has been a program for about 7 years, a little over 7 years. So that's when you really start to see growth and improvement in a wellness program or a wellness initiative. So we're very happy to see that year over year, our registrations, our site visits, and our reward lobby participation has increased. So that was really great to see, as well as those who have submitted biometric information. We'll see that blood pressure and cholesterol risks have declined, which is a great start because blood pressure is actually, and hypertension is one of the things that our members really have some high claims around. So this is great to see as well. So I do want to be, encourage other health plans out there that with this work of time, staying ahead of the trends, discovering what our populations really need, we are able to see some great improvement across the board. And it's really encouraging to see. So I appreciate you guys all listening. It was really great to chat with you. And I'm going to turn it back to Alex.
So with that, thank you again all for your time today. We really hope you enjoyed the presentation today and also the rest of your conference. And again, we'll all be here to answer any questions in that chat box below. Thank you.